Hi friendlies, this is Dr. G and welcome to ICU Confidential. Today's topic is about code status, specifically when do not attempt resuscitation or DNR status may be appropriate. For a discussion when full code or comfort measures only may be appropriate, as well as a discussion of general definitions of code status, check out those videos separately. When you come into the hospital, we do everything that's medically appropriate to try to find out what's wrong and treat it. We can't always anticipate medical emergencies, however. Code status, again, refers to what you would or would not want us to do in the case of a medical emergency. If your heart stops or goes into a rhythm that can't sustain you or you can't breathe on your own, we have the option of putting you through what we call extraordinary measures, where we perform CPR or cardiopulmonary resuscitation, chest compressions, where we put you on life support or a ventilator to breathe for you, where we shock the heart with electricity if required, and when we administer special medications to try to get you back. It's important to understand that when we put someone through this code or resuscitation efforts, it is a complex and physically dramatic set of interventions. Of course, we don't have that crystal ball to know if we're going to be able to get you back. The other consideration is that you will not be better after the code than before whatever happened to get you there. You may not have gotten enough oxygen, your blood pressure may be very low, and there may be organ damage, including heart damage, kidney damage, brain damage, and so forth. This may not be in line with your goals of care. The scenarios where do not attempt resuscitation or DNR status may be appropriate, may be reflected in your philosophy on life. If you, for example, feel that when you do get so sick that you can't breathe on your own or your heart stops, you want to be allowed to pass away a natural death and be let go as comfortably as possible, then do not attempt resuscitation may also be a medically appropriate choice to make. If, for example, you're at the end stage of your illness, be it an advanced cancer that has no other treatment options, heart failure that is unable to be reversed and you're not a transplant candidate, respiratory failure because of end-stage COPD or lung fibrosis, or one of many other advanced terminal conditions, and you come to a point where your body is no longer able to sustain you, even with all the external help that we can provide, putting you through those resuscitation measures may, number one, have a very limited chance of being successful, and number two, may only prolong the inevitable. In these scenarios, it's important to know what we can control and what we cannot. We cannot control what will ultimately happen. You will pass away from that end-stage terminal disease. What we can control is what happens between now and then. It's important to recognize that code status is your choice. As clinicians, we're here to give you as much information as possible and make sure you're well informed so you can make the best decision for yourself. One that is in line with your philosophy on life, informed by your medical journey so far. All these are very important questions to ask and discuss ahead of time before you have to make those decisions. For a discussion when full code or comfort measures only may be appropriate, as well as a discussion of general definitions of code status, check out those videos separately. As always, don't take your advice from social media. Those folks have no idea what they're talking about. This is Dr. G, and welcome to ICU Confidential.